Hi everyone, I'm Dr. Karam. I'm a board certified facial plastic surgeon and I specialize in facial rejuvenation. And today we're going to talk about a very common question / misconception that comes up a lot. And that is, what are the risks and what are the realities of fat transfer to the face? Everything I'm about to tell you is coming from my own personal experience, and I'm well aware that there are tons of conflicting accounts out there on the internet about everything I'm about to say. But I'm going to preface this by saying that I have been doing fat transfer since 2005, 2006, and I have done at least over 6,000 cases during the last 15 or so years. I don't think there's been a surgical day that has gone by that I haven't included fat transfer in part of my treatment of the aging face. I'm a huge fan of it, and I'm going to talk to you about both the benefits and the potential risks and why some of those things that you see out there and may have heard about are likely true in other practices, but our experience with it is different. So let's start with this. You're doing fat transfer in the first place because the face loses volume as we age. As the face loses volume, the face starts to look gaunt and hollowed and tired. So it obviously is an important aspect to try to restore that volume. Now, let me preface it also by saying, if you're watching this and you're thinking at the end of it, oh, I want to go get a fat transfer done, sounds amazing. If you have laxity in your face, meaning like your face is starting to age by coming down gravitationally, etc., and you're late 40s, early 50s, etc., fat transfer by itself is not going to be a solution for you. Fat transfer is going to be a solution for you in addition to a technique like the vertical restore or some other type of vertically oriented facelift, but it's not going to be a standalone in that case. If, on the other hand, you're in your 30s and you're starting to see some volume loss happening and you're contemplating between treating all these different areas with fillers, fat transfer is a phenomenal one and done procedure for that age group, but it's not going to be a solution for lifting the face. So I just wanted to make that clear. So before you get super excited and pick up the phone or send us an email saying, hey, I want a fat transfer, I wanted to make sure you understand what makes a good candidate and why. People are under the impression that fat transfer is a temporary solution. Fat transfer is permanent if it's done properly because the fat that is removed from, let's say, the legs or the stomach, which is usually where we harvest the fat, that fat in that location never goes away with age. Now, keep that in mind. But fat in our face, fat in our hands, those areas do go away with age. So what we're doing is we're playing a trick on the body by taking fat from an area, a donor site, that is fundamentally forever, and taking that fat out of that area using a very small cannula through a small incision, removing that fat, and then preparing it and getting it ready to inject in the face as micrografts. So you're taking tiny little bits of fat, putting it into the face and allowing the face to establish blood supply and make that fat a permanent part of the face. So permanence is the expectation. Permanence is a successful fat transfer. Now, why would some people say, oh, you need to have a fat transfer every 3 months, or the fat goes away, or fat, it looked great for 6 months and then I didn't see it anymore? Well, that's because the technique that was used was not proper and wasn't done the right way. So what is the technique? We're talking about harvesting it the right way, purifying or preparing it the right way, injecting it the right way, and knowing how much of it to inject. So there's at least 4 steps along the way that have to be done exactly right in order to get a great outcome. If it's a great outcome, boom, permanent. That's huge. No other volume treatment can give you a natural volume replacement using permanence other than fat transfer. So what are some of the things that we hear about all the time? Does fat transfer move? No, fat transfer doesn't move. How can it move? It's injected into the tissue. It's like, think about a steak, for example. I mean, your facial soft tissues are all layers upon layers. You stick it into one of those layers and stick another piece into another layer. These are micrographs, tiny tiny little grafts. You put it into these areas. Well, those layers aren't going to allow it to migrate back and forth. So fat transfer is not a mobile type of a thing. Sometimes you see that with fillers, but you're not going to see that with fat transfer if it's done properly. Other questions is, hey, I heard you can get lumps and bumps from it. 100% you can get lumps and bumps from it. If you inject a lump or a bump, you're going to get a lump or a bump from a fat transfer. If it's injected evenly, smoothly, when you watch my motion of injection, it's kind of this rapid back and forth where I'm delivering tiny little dots of fat across, almost like snowflakes falling onto the ground. It's going to look smooth. I've never had a lump or a bump in 6,000 cases because it's always injected smoothly. Is it going to be uneven between the two sides? No, why would it be uneven? If you inject the same amount on the left side as you do on the right side and you do it in the same areas, it's always going to be the same. There's nothing inherently different between the left and the right side of the face. I've never seen desperate changes, between the left and the right side. It's always the same. These are all sort of common things that come up. Permanence, lumps and bumps, irregularities, all that kind of stuff. Certainly things like infection can happen. I mean, that's true for any type of injection into the skin or any type of cut in the skin, you can get an infection. So sterile technique is super important. We do this in the operating room under sterile conditions, exactly the way we would do a surgery. Sterility is key. Knock on wood, we really haven't seen honestly any fat transfer infections if it's done properly. The one big one that comes up a lot is, hey, what about injecting it into an artery or vein and then you get blindness and all this kind of stuff? So that can definitely happen. You hear that kind of stuff happening with fillers all the time, especially when it's injected around the eyes. But you got to remember that the instrument that we use for fat transfer is a micro cannula. It's a very thin torpedo-shaped device, which is round and blunt at the tip. So as a result, it's not going to penetrate into a vessel the way a needle would. Here's kind of the additional method that I use to prevent that from occurring. I inject epinephrine into the tissues, and epinephrine causes blood vessels to shrink. So if a blood vessel that was this big before epinephrine, once you put the epinephrine, it shrinks down like this. So it makes it even harder for a cannula to penetrate into the lumen and deliver fat, because the cannula will be much bigger than the lumen of these small blood vessels around the face. You hear those type of things happening a lot more when people are doing like Brazilian butt lifts and breast augmentation with fat transfer, because the vessels in those areas are much bigger. Very, very small vessels in the face. And again, I inject everything with lidocaine with epinephrine because we do this under local with IV sedation. I need everything to be numbed, and the epinephrine keeps it from bruising. So you get a lot of benefits from that measure, that technique. What about the fat growing and growing out of control? Well, why would the fat grow out of control if it's the same fat that belonged in your leg? Your leg fat doesn't grow out of control. But if you gain 20 plus pounds, well, of course it's going to grow up a little bit. That's what it would do in your thighs. It actually has a larger buffer in the face than it does in the thighs. You really do have to gain like 15, 20 pounds for there to be any changes in the face, which is a really good thing. If you happen to lose weight, your face isn't going to shrink down on you, but also at the same time, it gives you a buffer to gain a little bit of weight without having those issues as well. So I wouldn't say that's a risk, but that is something to keep in mind. You want to do it when you're a little bit heavier, as opposed to, let's say, if you were overweight and you lost a ton of weight and then you did a fat transfer and you're unstable with your weight and all of a sudden you gain 25 pounds, then you run the risk of your face being a little bit fuller. But again, the way I do it, I put a little bit everywhere, so your whole face proportionally would get a little bit fuller. If that were the case, it wouldn't end up causing one area to get bigger than the other because of the way I do it in my practice. What are some of the other important benefits? Number one, it's replacing like with like. You lose fat, you put fat back. You don't have to worry about foreign bodies. You don't have to worry about the body attacking it, breaking it down, inflammation, etc., like it does with fillers. It's natural, it belongs there. Your body wants to make it, a part of it. So you're getting a full replacement of the volume that has been lost. Now, remember, I said replacement. I'm not talking about augmentation. When people put in fillers, they're trying to put it in the cheeks. They're trying to put it, in different areas, jaw lines and things like that, because they're trying to bypass surgery. Here, when you're using it, usually in either conjunction of surgery or in a younger person who just lost some volume, you're simply replacing it. Replacement always looks much more natural if it's done in a balanced, uniform sort of a way, a little bit in all these different areas. And remember, everyone has a different loss pattern, so the replacement needs to be customized. So in our practice, we have a technique called customized fat grafting or fat transfer. Those are all the, sort of the benefits of it. If it's done properly, it's natural looking, it's permanent. There's a soft, cohesive harmony between the areas. It doesn't look like all of a sudden you have a lot of puffiness in your cheeks or puffiness in your temples or puffiness in your lips and things like that, which sometimes you can get with fillers because people go in and get the same area treated over and over again. With fat transfers, we just treat everything the way it needs to be treated. Another added benefit on top of everything is the presence of stem cells. I would say is a really kind of unsung hero. These stem cells that are very, very prolific and common in the fat tissue. Once they're injected into the face, they start having rejuvenative effects on the skin, on the soft tissues, on fine lines and wrinkles, discoloration. There's all these kind of improved benefits that you see in the long run with patients who've had fat transfer because of the stem cell effect. That's sort of the gamut of things related to fat transfer. The myths, or I shouldn't even say myths, dispelling what people consider the truths about fat transfer, which really belong to certain less experienced practices, but wouldn't apply to surgeons who do this all the time and who've really mastered the craft of fat transfer. For all of us who do that, which unfortunately is a very small number of surgeons around the world who really do fat transfer at high volumes and do a lot of it and really mastered it and control it, we love it. I mean, we get great results. It's not going to be overfilled. It's not going to be underfilled. It's going to be just right. One procedure and done. We're not doing this touch-ups or adding more and all that kind of stuff. Our patients are happy, and it's really kind of the cherry on top of a lot of our surgical outcomes. Like, for example, I will not do a lower blepharoplasty without a fat transfer because the combination is so necessary and important to get a refreshed looking eye. I won't do, in most cases, a vertical restore without a fat transfer because it just looks kind of half done. So hopefully this kind of puts things into perspective. Don't generalize about everything that you see and read. Remember, they are specific to certain practices and not to all practices, especially those who know what they're doing with fat transfer. If you have any questions about this at all, drop them in the comments below. I will do my best to answer them. Lots of information about this on our website as well. Tons of before and afters on our website and Instagram, so you can find more visuals on this. If you haven't already, subscribe to this channel so you can get more content like this delivered to you every week. Share it with friends and family to kind of spread the good word, and like it to get this in front of more people. Really appreciate all your support, guys. It's with great pleasure for me to be able to deliver and provide this content for you. All right, guys, so until next time, Dr. Karam, enjoy, and more to come. Thanks so much.